You ran inside and slipped out an ice cube.
By popular demand today, we are back at it again with an educational reaction video to SpongeBob SquarePants. I can't wait to break down more of the crazy medical type situations that Bikini Bottom has to offer. But before we get into it, if you are new to my channel, welcome. My name is Dr. Jordan Wagner. I'm an ER doctor. If you enjoy the educational reaction videos and other stuff that you see here on this channel, please smash that subscribe button and turn your bell notifications on. That way you learn when I post a new video. All right, let's dive right in.
SpongeBob, you nincompoop! You broke my face! Don't just stand there, help me! I need a doctor!
Nice.
Hiya, Squidward!
I have never, in my whole career, have ever seen full facial bandages. It doesn't happen. Face is a weird place to try to bandage up. You just put a bandage over the area that needs help. I've never seen anything like this where you just have all these full bandages. It doesn't happen.
We can't really have you in here today. I'm going to be removing Squidward's bandages, and he made me swear to keep you far away from him.
Gosh.
Don't worry, Doc. I promise to stay out of the way.
A lot of times we get people come to the emergency department and be like, I think I broke my nose, and they want images. Now, we can pretty much tell you if you broke your nose or not. If it is way off, like whew, all the way aside, we could potentially pop it right back into place. It's hard to even know if it's gonna stay off because of the amount of swelling that you're having. Whoa, cut the bandages off.
Sorry, go ahead. What?
What is it?
Are you sure the patient has enough of Sarah?
I have no idea what that is. Please, just let me work.
Very well, Doctor. Carry on.
Yes. Be quiet, observe when you're in the room, when there's scissors and sharp objects.
I can't believe it!
What
SpongeBob,
happened?
Yeah?
how does
Is it beautiful?
look? Quick, hand me that mirror! What the-
Uh-oh.
A second.
Oh, it's
That
like a
nurse
normal
was
nose.
right. I am handsome.
He's looking good.
Squidward, you're not handsome. You're a hunk!
A lot of times with facial wounds and scars, they may not always heal the way that you want them to heal, but you can follow up with a plastic surgeon later, and then you can actually cut that scar out and then revise it. Just something to think about. Oh! Oh!
My leg!
This guy's just not good with his legs.
Over with. My leg, my leg, my leg, my leg, my leg! Feels great!
When you initially break a bone and go to the ER, we put a splint on it. A splint is a half of a cast. It's the same material. We do that on purpose. That way it allows for swelling. Because if we put a full circumferential cast around the area, it'll swell and then we'd have to cut it off. We do have saws that cut casts off, but they actually do not spin like it is in the show. It actually just vibrates. It actually vibrates in a specific direction.
Thanks, Doc!
I'm glad, Fred, but you've got to be more careful with...
Nice, a good fracture on the x-ray. It looks like there's a fracture right through the tibia. You can't see the fibula, which would be on the other side, which is the small bone on the outside. It's a non-weight bearing bone, but it makes up their lateral malleolus. This fracture, looking at it, it's comminuted. So typically, I'm not an orthopedic surgeon, but if it's really destroyed like this, they'll put what's called a medullary rod through the middle of it. But sometimes you can actually put a plate and screws in there as well. It all just depends on how much bone is there or not.
Just your leg!
Don't take advantage of your body. You only got one of them. Maybe you have two legs, but you don't want to be hopping around if you don't have to. Oh, it's choking. Universal sign. Oh, a fork in the neck. There's so many times people come in, they swallow accidental shapes and sizes of different things. Most of the time, these are safe and fine, and it happens. Yes, we're gonna do some imaging and see if there's something stuck in there, but most of the time there's not. If there's perforation, we can typically see if there's air on a chest x-ray in the wrong place.
Whoa, Squidward, you're choking!
Yeah, no crap, he's choking. The universal sign of choking is 2 hands around the neck. You go up to the person, ask them, are you choking? And they'll confirm. You say, okay, I'm gonna do the Heimlich maneuver. Heimlich maneuver, you take your fist, put it just below the ribs, and you're pushing in and up in a kind of motion. Squeeze them. And you're trying to kind of force it out. What the heck? Oh my gosh. As I said, if somebody progresses to where they lose pulses, you will actually start doing CPR. And depending on your protocols, where you are, typically we don't do mouth-to-mouth anymore, rescue breathing, but we'll use like some sort of BVM to basically breathe for the individual to get oxygen in. It works? It almost works. Nice.
I win!
If you can't get out, get into the hospital ASAP. We have different tools that we can go and look. We have McGill forceps, laryngoscopes, we have bronchoscopes, and then we can even have a different type of camera, which is for endoscopies. So we can actually see in there and try to grab it out as well.
SpongeBob SquarePants am tough enough to get into the salty spittoon.
Oh, nice.
This is the happiest day of my life.
Uh-oh.
Sandy,
What happened?
What happened?
you ran inside and slipped out an ice cube.
Oh, that sucks.
I slipped on an ice cube and got covered in boo-boos.
People come in for all different ailments, all different injuries. We all have a different level of pain tolerance and pain threshold. But I will tell you this, we get so many people that come into the ER telling me, hey doc, I got a really high tolerance for pain, but can I get some pain medication? But again, it's not my job to judge. If somebody says they're in pain and they don't have an obvious history of drug-seeking behavior and we know that there's issues, we treat it.
Boo-boos, eh? I think you guys want that hospital.
Weenie Hut General.
Oh, messed up. The only times we really send you to a different hospital is like, say, of a service that we don't have at the current one you're at.
Order up, Squidward.
Here you are, sir. One Krabby Patty.
What the? Ooh, it's a little...
I don't understand. We haven't had a customer in weeks. I wonder if it's the new placemat.
It's that old Patty you keep trying to sell to everybody. It's gone bad.
Gone bad? That's nonsense. Bring it here, SpongeBob.
Oh no. Oh my gosh. It's alive. I love it.
Let's see how bad you are.
Don't do it.
Girl. See? Good enough to eat.
Yes, that is one thing that can cause it. As an ER doctor and any doctor, a lot of different like bacteria or viruses can cause nausea, vomiting, diarrhea, and abdominal cramping. It's horrible.
Make sure you wrap up that patty. I'm not finished with it yet.
The other question is, why did he go to the operating room? So could he have gone to the operating room for maybe like a bowel perforation that it ruptures your stomach, your intestines, and now you have stuff leaking into your abdomen. It needs to be opened up, and then that section of the bowel repaired typically by cutting it out. But it's kind of interesting.
Let's just check your chart. Let's see here. Oh no. Oh no. This is
What the heck?
terrible.
Everything okay, Doc?
Don't touch me! Ah!
That's not a good sign.
That's not good. One, that's a bedside manner is atrocious, okay? You do not freak out. You freak out, everybody else freaks out. You don't do that. Now, I wonder what he's got that would actually cause that. Not sure.
How do we tell him?
Don't tell him. That'll only make him feel worse. The way I see it, he's only got until sunset. Why ruin his last day on Earth? The lad deserves to enjoy his final hours.
We will have families where they don't want us to tell the patient or their loved one, like have a really like terminal illness. If that family member has power of attorney, sometimes we need to abide by what they want us to do. But my adage is always tell people the truth.
Turn left and stop. See? That's what it'd be like if you had me for a face.
I can't breathe. Are you sure you should be poking it like that?
Who's the doctor here?
Oh, poking a heart with your finger is very much unlikely to cause a hole in the heart. You'd have gloves on, masks, operating room. You wouldn't be awake while somebody's poking your heart, all these different things.
Stop! Stop!
We deal with end of life all the time, And there's always a conversation of continuing therapy and care and these different things that could potentially cause you to not enjoy the last days, weeks, months of your life versus don't do any treatment and enjoy. So it's nice having friends around to be able to help. I really enjoy the medical clips that I'm seeing in SpongeBob SquarePants. Please let me know in the comments. Give me some more episodes or scenes to check out. If you guys like this video, I know you're gonna like this one, so check it out. And as always, make sure you subscribe, turn your bell notifications on. Thank you so much for watching and stay healthy, my friends.